Hello guys! Welcome to Tintin at Amparong channel. Last week, nag-unbox ako ng Poco M3 Pro 5G. Ngayon naman, mag-unbox din ako ng BP machine. Lazada. Ito ay BP machine. Ayan. Okay, sa loob ng box niya is the unit, the manual, at saka blood pressure cuff. At saka battery niya. Okay, kakabit ko na ang battery niya. Tingnan natin kung mag-on ba siya. At ang blood pressure cuff, ikabit mo siya sa gilid. Okay, sa kanyang display is meron siyang systolic at diastolic at saka pulse. Diyan makikita ang iyong blood pressure number. Meron siyang set, sa gitna, stop, at start. At memory. Original price niya is 1,999. Mabibili mo siya sa Lazada, Shopee, at sa lahat ng botika or drugstores nationwide. Sa Lazada lang, mas mura siya, which is 649 pesos. Special features niya is voice sound or talking machine.
Your blood pressure is systolic pressure 103 millimeters of mercury, diastolic pressure 70 millimeters of mercury. Your pulse is 73 beats per minute.
Okay, understanding systolic and diastolic blood pressure. During a heartbeat, the heart is pushing blood out into the arteries. Doctors call this systole, and that's why it's called the systolic blood pressure. It's the pressure during a heartbeat and the highest pressure measured. When the reading is 120 mmHg or a little below while a person is sitting quietly in rest, the systolic blood pressure is considered normal. This is the typical systolic blood pressure ranges from normal to hypertensive crisis. The high systolic blood pressure, the heart muscle pushes out blood with higher pressure when a person is exercising, under stress, or at similar times when the heart rate is increased. The systolic pressure goes up with it. When the pressure is high while a person is resting, that's considered high blood pressure. That's why it is so important to take your blood pressure during periods of quiet rest to diagnose hypertension or high blood pressure. High systolic blood pressure is usually caused by narrowing of the arteries, which makes the heart have to work hard to push blood through. If low systolic blood pressure, if the systolic blood pressure is lower than normal, it's called hypotension. If this low blood pressure is serious enough, it can cause lightheadedness, dizziness, or fainting. If it lasts long enough and it isn't treated, it may cause organs like your kidneys to start shutting down. Systolic hypotension can occur if the amount of blood in your body becomes too low. This can happen if you are severely dehydrated or you have major bleeding. There just isn't enough blood to push through the body. It also may happen if the heart muscle is too weak to push blood normally, as in cases of cardiomyopathy or damaged heart muscle, or if the artery suddenly widened too much, as in vasovagal syndrome, or a reflex that causing fainting. Sometimes this low blood pressure happens when you change position suddenly. You may feel dizzy when you stand up because gravity is pulling blood down toward your feet. This is a common condition called orthostatic hypotension. Diastolic blood pressure naman, the heart rests between beats so it can refill with blood. Doctors call this pause between beats diastole, Your diastolic blood pressure is the measurement during this pause before the next heartbeat. A normal diastolic blood pressure during quiet rest is 80 mmHg or a little below. If you have high blood pressure, the diastolic number is often higher, even during quiet rest. Low diastolic pressure may be seen with dehydration or with severe bleeding. It also may happen if the arteries relax and widen. This is the typical diastolic blood pressure ranges from normal to hypertensive crisis. How to use BP machine monitor. First, you connect the blood pressure cuff on the unit. And then, wrap the monitor around the left hand palm. Then, wrap the wrist cuff around your wrist about 10 to 15 mm away from the hand. Then 3. Place the hand at the same level as your heart when measuring it. Then, stay calm and quiet while monitoring is in running. Na-explain ko na ang nai-unbox ko, which is BP machine. Salamat po sa panunood. Don't forget to subscribe Tintina Tamparong channel. Salamat!